So Dr. Amy B. Killen, she is the co-founder and CMO of Humanaut Health and the founder of the Health Optimization Project. She's a longevity researcher, practitioner, regenerative medicine, amazing speaker, and you all are going to just absolutely love her talk today. So come on up, Dr. Amy.
Put your hands together for Dr. Amy.
Hi, good morning, everyone. Welcome. So my topic today is what I call achieving SEXponential medicine. This is a word I invented, but it's kind of about, we talk about the exponential increase, rise in medicine right now, like all the things that are happening in medicine where you're having, you have AI coming together with robots and nanotechnology and all this information. And so we have this really big increase, this exponential rise in what we're learning and we're able to do. And similarly, in sexual medicine, we also have this exponential rise in what we're learning about it. It was a big article. They had followed more than 12,000 people for up to 11 years in the US. And what they found was that people who have sex at least 52 times a year had a 50% lower all-cause mortality rate compared to people who were not having sex. Said another way, people who had sex at least once a week had a 50% lower chance of dying during the course of the study, that 11-year study, compared to other people. Now, this is similar to other studies we've seen out of Wales. A very similar study in men showed the exact same thing. There is a study in Japan that was focused more on men and libido, but it basically showed that men who have a higher libido have a significant reduced mortality rate compared to men with lower libido, even when they controlled for diabetes and high blood pressure and marital status and psychological issues and even the amount of laughter in their day. They still found that a high libido was associated with a longer life. That was in men. Now, in women, it's a little bit more complicated. Of course, we're always more complicated, right? In women, it may not be as much about quantity as quality. There was a study out of the gerontologists in 1982, and they followed people for more than 25 years. And they looked at the 22 lifestyle factors that were most associated with longevity. And they found that for men, it was the quantity of sex they were having was associated with longevity. For women, it was the quality. Did they enjoy it? Was it pleasurable? Were they having a good time? That was associated with longevity. So for men, you essentially have to go to the gym and you run on the treadmill, and that's enough. For women, we have to go to the gym, run on the treadmill, and enjoy ourselves for it to be enough. So it may be not quite so fair, but there is a relationship there. Now, what you may be saying is, well, Amy, this is correlation, it's not causation, and that's totally true. I'm not necessarily saying that having a lot of sex is going to make you live longer. I'm not saying that. I am, however, saying that there are a lot of documented benefits to a healthy sex life, right? We know that there are emotional benefits, less depression, less anxiety, better self-image. There are cognitive benefits. Older adults who have a healthy sex life tend to have less shrinking of their hippocampus in their brain, and they have better memory, less dementia. We know that there are physical benefits like less pain, better sleep, lower blood pressure, better immune response, even longer telomeres in one study in women. And of course, there are the social benefits with the relationship. People who are sexually active and have a happy sex life tend to stay together longer than people who are miserable in the bedroom. There are also some really interesting neurohormones that come into play during sexual activity. And this is a busy chart. I realize it. You don't have to understand it all. However, I'll go over what some of the key things are. So during sex, during the sort of desire, arousal, orgasm phase, you have the release of dopamine. So you guys have heard dopamine, right? Dopamine is the expecting hormone. It's the hormone that is saying your body's like, oh my gosh, something good is going to happen. I can't wait. That's your expecting hormone. And we see high dopamine also, when you have a lovely meal that you're going to eat, or maybe when you're gambling, or you're a cocaine addict. Like, these are all dopamine hits, right? Social media is a dopamine hit. So you get that during the early parts of sex also. And then you also get the endorphins. And these are the same things that happen when you go for a long run. You get that runner's high. So the endorphins act like opiates, and they also activate the endocannabinoid system in your body. So it helps reduce pain. So this makes sense. This is why sexual activity can actually decrease pain, like migraine pain, pelvic floor pain, different types of pain. You also have serotonin, which is your feel good. It's your like, I'm content with things. Now, serotonin, of course, you can get that from sunshine. You can get that from exercise. You can get that from Prozac and medications like that. And then you also have oxytocin, which is one of my favorite hormones, because oxytocin is the bonding hormone, the love hormone. You've heard of this, right? It's like the one the mothers have a lot of with their babies. But oxytocin is the anti to cortisol. So cortisol is high, oxytocin's low, oxytocin's high, cortisol's low. And not only does oxytocin reduce how much cortisol you make, it also protects your brain from the cortisol that's already there. So it's like a shield protecting your brain from the negative effects of stress. And since we know that stress contributes to, in a major way, about 75% of diseases, if you can keep that cortisol down and oxytocin up, it's a good thing. So I like to joke that in order to get all of these same hormones in one place, you'd have to go for a long run with a puppy strapped to your chest while snorting cocaine and popping Prozac. You can do that if you want. You could do it. Although I honestly, put this on the record, I do not recommend it. So I see sexual health as kind of sitting at the middle of this ecosystem of health. So you have mental health, emotional health, spiritual health, social health, which is relationship, right? Physical health, environmental health. And in between all of that is sexual health. So sexual health is both a biomarker of health. So if you're having a problem with any of those areas, we can see it in your lack of or problems with sexual health. And also sexual health radiates out and positively affects those other areas, right? By the way, this is me. You guys got the introduction already, so I won't belabor it, but this is me. I'm Amy Killen. I am a physician, formerly ER doctor. I did emergency medicine for about 10 years. And in 2013, when my kids were little and I was pretty stressed out, I realized that if I didn't make some big changes in my life, I was going to end up being a patient in the ER with some sort of chronic medical problem that probably could have been prevented. So I decided to make the change and learn about a new type of medicine. So since that time, I've been practicing preventative medicine, integrative medicine. I do a lot of hormones. I do regenerative medicine, like stem cell medicine. And I have a few different companies, clinics, supplement companies, multiple different things, but all in the same space, all in this, how can we prevent problems before they happen? How can we make you feel better for longer? All right, let's get into some numbers. 20% of marriages around the world are sexless. 20%. 17% of millennials check their smartphones during sex. During. If that is any of you, please leave the room. Don't do it. 40% of men over the age of 40 have some degree of sexual dysfunction. And that number goes up by 10% per decade. 50% at 50, 60% at 60. You can do the math there. 40% of women, no matter what age, have some degree of sexual dysfunction. And when I say dysfunction, this is not me putting a label on them. This is people coming in and saying, I have problems. Like, this is a problem that makes you uncomfortable, that bothers you. So it can be low libido. It can be arousal problems, like blood flow problems. It can be orgasmic issues. It could be pain. It could be any of those combinations of things. 40% of women have some degree of sexual dysfunction, if you ask them. There's a study by Alexander Drain about 10 years ago, and it was really interesting because what she did was they looked at the things in your life that bother you and frustrate you and take you away from taking care of your medical problems. So you're so frustrated or stressed that you don't go and pick up your blood pressure medication, or you don't go see your doctor, or you don't take care of whatever medical problem you have. And what they found was that second only to financial problems, an unhealthy sex life contributed to people ignoring their other medical problems. So that arrow right there, that's the second one. And it's interesting. We don't think about this as being true, probably. Like if you were to think about this, but it's not just that a healthy sex life contributes positively to your health. It's also true that an unhealthy sex life, if it bothers you, That's what makes it unhealthy. If it bothers you, it contributes to your life in a negative way because it pulls your attention away from some other things that you could be doing to make yourself healthier. So when we talk, and also we're going to go into some strategies here next, but as we get to this section, well, the question I ask for you to ask yourself is, what do I have to lose? If you don't take care of your sexual health, if you don't pay attention, we know that action follows attention, right? You have to pay attention to something or you will not act. You will not make any changes. So what do you have to lose if you don't pay attention to your sex life? Maybe you have your partnership is to lose. Maybe you have something else, your physical health, maybe your mental health. It's different for everyone, and maybe you don't have anything to lose. Maybe you don't care, and that's totally fine too. But if sexual health is important to you, then you have to pay attention to it, and then that attention you have to act on. So what do we do about that? So this is my 4-pronged approach to sexual longevity, and it's pretty simple. Mind the mind, boost blood flow, optimize hormones, support the structures. And we'll go through each of those. So the first one is mind the mind. So a good friend of mine came to me and she told me the following story. She said, Amy, recently my husband came home from work. Now, just to give you some backstory, she and her husband have been having a lot of marital problems. They weren't connecting well. They were working opposite shifts. They just weren't seeing each other. They were arguing a lot, and they weren't doing great. But she said one day my husband came home from work, and he said, I have done the laundry for the entire week. I have folded everything. I've washed it. I put it all away. And now I want to give you a 15-minute clitoral massage. And my friend said, this had never happened before. Like either of these things had never happened before. And then she said, you know what, Amy, I don't know which one I enjoyed more. That massage or the fact that laundry had been done for the entire week. So the point of the story is that stress and to-do lists are a major reason that we have issues with sex right now in the world. And this is true, I think, at any age. And it's true for men and women, but I think it's especially in women. We just get so overwhelmed with all the things we have to do. And with sexual health, in order to actually have sex, you have to have some activation of your parasympathetic nervous system. So sympathetic is fight or flight, right? That's go, do, give. That's fight or flight. Parasympathetic is the opposite. It's what I call rest and receive. Some people call it rest and digest. I call it rest and receive. This is me, by the way. But parasympathetic is less about go, do, give, and more about stay, be, receive. So you have to be able to receive things like compliments and touch and pleasure. And that sounds easy, but it's actually really hard to shift over into that parasympathetic state when you're living your entire life in the sympathetic, in the fight or flight, right? It's really difficult. So I encourage anything that gets you there. And we'll talk about some devices and things in a minute, but something else I think is really fascinating is that some of the brain changes that happen in women in midlife. So this is from Lisa Mosconi's work, and it's looking at a premenopausal brain and a postmenopausal brain. And the red is activity, like high activity of the brain. So it's actually looking at glucose metabolism. So you can see in the premenopausal brain, you've got lots of red, lots of activity, lots of things going on. In the postmenopausal brain, you have less. And in fact, there's a 30% drop in brain energy that happens during perimenopause. Perimenopause is the 2 to 10 years before menopause. This can start as early as age 35 and still be considered normal. It can start earlier than 35 in people who have premature ovarian insufficiency. So this is something that happens to women in midlife. Your brain literally dims by 30%. You do not have your brain, unless you take hormones, which we'll talk about later, your brain does not have the capability to do the things that you used to do from an energetic standpoint, which I know is crazy. Now, some of this does come back a little bit later in menopause, but during perimenopause, it dims. And one of the things that we see is a big drop in libido, because that's coming from your brain, right? That's in your brain. So this is not all about how you deal with stress. There's also some neurochemical things happening during this time. So there's tons of stuff out there that you could do. So certainly there are the ancient practices, which I highly recommend: meditation and breath work and journaling and getting outside in nature, which is my personal favorite. I like to go hiking. There's a lot of mountain lions in my neighborhood in Salt Lake. So I do a lot of hiking and talking to myself in hopes that they will not come near me if I'm loud enough. But people who on our trail, they see them and they're like, why is this lady talking to herself? Kind of weird. But anyway, I recommend all those things. But there are also some interesting gadgets out there, that anything that can help shift you into that, increase the vagal turn, shift you into parasympathetic can be interesting. Like you could do photobiomodulation where you put different lights on your head, and the studies on that looked at depression. But I found that also improved depression, but also improved libido and arousal in people. There are multiple different devices that activate vagal tone by, looking at putting on your wrist or your ear or your brain. Many different things out there. There are apps that can help you kind of shift into that, like Headspace and things like that. So there's lots of stuff out there that you can do. We also have multiple different medications, peptides, supplements that we can use clinically to help activate the brain, activate libido and arousal in the brain. And these are some of the pathways, and I won't go into each one, but there's a lot of things that can be done by medical doctors as well. The second part of our four-pronged approach is boost blood flow. So your sexual organs, just like any organ in your body, really appreciate good blood flow, right? And we know this because in men, erections require blood flow. But guess what erections in women require? Blood flow. You guys, that was an easy one. Blood flow. In fact, women get erections too. Do we all know that? Yeah. The clitoris is like a little baby size of a penis. It gets blood flow. So we need blood flow. Everyone does. In order to get, for women, you get the arousal of the clitoris. You also get vaginal lubrication comes from blood flow. And then getting an erection is blood flow. And as we get older, we start to get plaque in our blood vessels. You got your atherosclerosis that triggers heart disease. That is basically plaque filling up your blood vessels. And so anything that you can do to reduce your risk of heart disease, reduce your risk of heart disease and stroke, cardiovascular disease, is going to be good for your sexual health. Anything you can do to reduce your risk of heart disease. So that's some of the normal stuff that you have heard about probably many times. Don't smoke. Exercise at least 150 minutes a week. Stay at a healthy weight. Eat a healthy diet. Sleep well. Manage stress. And then there are some lab tests, like keeping your blood pressure lower than 130/80 is ideal. Keeping your blood sugar low. Did you know that, we certainly know the high blood sugar causes diabetes, but there's actually kind of a middle range. There's pre-diabetes, and then there's not so great but not perfect, and then way down at the bottom there's optimal. So you really want your hemoglobin A1C, when your blood sugar has to be low, to prevent not just atherosclerosis but other medical problems. Lipids, so your cholesterol, you want to make sure that you're keeping that low. ApoB is a great marker. This is it's not really new, but it's being talked about more recently. It's a different way to look at your cholesterol, your LDL cholesterol. And we're finding out more and more that keeping that level low, like less than 70, which is fairly low, is much better at preventing heart disease. And that's going to help your sexual health as well. And then keeping inflammation down. CRP is a marker of inflammation. And it's one of those tests that all these tests your doctor could do on basic labs. And you should have these done at least once a year to make sure that you are metabolically healthy. 88% of adults in the US are not metabolically healthy. And all of that means increased risk of heart disease. This is a blood vessel, and it's showing you over time the buildup of plaque. So you can see in your 20s, you don't have a lot of plaque. That yellow gunk that's building up is plaque. So you can see it's narrowing the blood vessels. And when you get a heart attack, what happens is some of that plaque breaks off and it travels to your heart and causes obstruction. And then you get no blood flow to the heart in that area. And that's what a heart attack is. So the plaque is bad. Now, one thing that the blood vessel lining normally does is make something called nitric oxide. Has anybody heard about nitric oxide? Some of you, good. So this is a chemical that is important for what we call vasodilation, opening up the blood vessels so you can get blood flow to different parts of your body, to your brain, to your heart, to your muscles, to your genitals. Nitric oxide is made partially by the cells that line your blood vessels. And as you get older, you are able to make less and less nitric oxide. So you can see that by the time you're 50, you're only making 35% of nitric oxide like you were when you were younger. This is a big driver of cardiovascular disease. And you can see from this graph, the black line is people who had a good diet and good exercise. So healthy people. There's nitric oxide does still go down with age, but doesn't go down as quickly as it does if you are unhealthy, like the red line. So this is really important. So there are a lot of things you can do to increase your own nitric oxide. So low-tech things like exercise, like you get a little bit of sunlight, like eat nitrate-rich foods. That's like beets and greens and oranges, like citrus. I was thinking citric acid for something. Citrus. And the other thing you want to do is you want to make sure you're avoiding antiseptic mouthwash, like Listerine, or at least avoiding overusing it. Occasionally is okay, but antiseptic mouthwash kills the good bacteria that are in your mouth that are needed to process those nitrates and make them into nitric oxide. So you're eating all this greens, all this kale, all this spinach, and it's all for naught because you're then using Listerine every day. So skip the mouthwash, or at least the antiseptic mouthwash. And you also, if you can, avoid stomach acid blockers. These are medications that you might take for your heartburn. And certainly those are okay in short periods of time. But long-term use of those can also affect nitric oxide production. The high-tech things you could do, maybe you'll find these in the exhibit hall. Red light therapy, red light photobiomodulation. The beds that you lay in are great for nitric oxide. Certain supplements like Neo 40 or N101, PEMS, which is pulse electromagnetic field therapy, you've probably seen as well. Hyperbaric oxygen. And then medications. Viagra, Cialis, actually works by preventing your body from breaking down nitric oxide as quickly. So it keeps the nitric oxide in your body longer, which is why you have erections for longer. To see it all ties together. And then Viagra is actually really healthy. People don't know this, but it actually has a lot of cardiovascular benefits as well because nitric oxide is so good for your cardiovascular system. So that's blood flow. The next one is optimized hormones. And this one is near and dear to my heart. I talk about hormones a lot with my patients and online because I do think this is a very important and kind of misunderstood category of medicine. So this is what I call the sexual response snowman. And this is the one for women, but the one for men looks fairly similar. You can see that there's desire, arousal, orgasm. And then you can see all these things around it that affect those three areas of sex, right? Now, if it has a red arrow going from it, then that means it's activating that thing. If it has a blue arrow going from it, it means it's inhibiting that thing. So you can see that estrogen and testosterone at the top are activating desire. Progesterone also activates desire. And then at the bottom, you can see that testosterone is activating orgasm. So is oxytocin. And some of the inhibitors, you can see serotonin inhibits, opioids inhibit, so medications that are opioids, and then prolactin as well. So these are, the point of this slide is to say that these hormones, estrogen and testosterone specifically, to a lesser extent progesterone, are important in both men and women for that sexual health snowman. Okay? Now, what happens to women's hormones over time? So you can see from this visual here, estrogen's in yellow. It's kind of hard to see the yellow, but you can see it. So estrogen is going along, and then all of a sudden it literally falls off a cliff. Like this, in a couple of year period, you go from making estrogen, making it, and then you lose your ovarian function at menopause, and your estrogen falls off a cliff. So this girl, you can see she's like falling off this cliff. And as that estrogen goes down, look at the bottom here. Do you see the diabetes risk and cardiovascular disease risk and how they start to go up? The exact time that estrogen's going down. And you can see at the very bottom, that red dot, that pink dot, that's menopause. So menopause, essentially, when your ovaries fail, because you run out of eggs, because you have no control over this right now, although there is research into this, but you run out of eggs, you lose estrogen and progesterone production by your ovaries, you lose estrogen specifically, all of a sudden your risk for heart disease goes up, your risk for diabetes goes up, your risk for dementia goes up, your risk for osteoporosis goes up, your risk for sexual dysfunction goes up. And that's all mostly estrogen. Testosterone plays a role, but doesn't go down as quickly. It's just kind of a gentle curve. Now, in men, testosterone, it doesn't fall off a cliff as much either. It's kind of this gentle decline that starts at around age 25, where it just kind of slowly marches down. Now, the difference is that men, if you lead a healthy lifestyle, if you lift heavy weights, if you reduce your adiposity, your fat in your abdomen, if you get some sunlight, if you sleep well, if you keep your stress low, in men, you can generally keep your testosterone up. Not always. Sometimes your testes just give out and they're just like, I'm done. But in general, lifestyle has a big positive effect on testosterone production in men. So your curve doesn't have to fall. I was talking to a guy last week. He was 75 years old and he had testosterone of 900 and he wasn't taking testosterone. I mean, probably that's genetics plus a healthy lifestyle. But you do have some control over this. Women, you have no control. You have no control over that estrogen falling off a cliff. And no, if anyone tells you that you can balance your hormones with any sort of supplement, any sort of lifestyle, any sort of meditation, they are incorrect. So what can you do? Certainly a healthy lifestyle is always important for everyone. It's not going to bring back your hormones for women, but it is important for how your body deals with the changes. Also, avoiding endocrine disruptors in the environments is very important. So, we know, of course, that there are many things out there in the world now that affect our hormones. I see Cynthia Thurlow here. She's going to talk about hormones next, I think, for women. But basically, there's all these disruptors out there in the world that can affect your body's ability to make these hormones. These can be in your skincare. These can be in your pots and pans. These can be in your fragrances in your home. They're everywhere. And if you can't avoid all of them, honestly, but if you can do your best to filter your water, to not use the Teflon pans, to, use safer skincare products, things like that, that will help as well. And then you can also go to your doctor and get hormones prescribed if you need them and if you want them. The next thing, the fourth tier here, is support the structures. So the structures I'm talking about are the genitalia and the pelvic floor. The pelvic floor is actually really interesting. You have the pelvic floor is kind of like a hammock-shaped muscles, and like it's right here for men and women, and it supports all your pelvic floor muscles, right? Your organs. And these muscles are associated very closely with your abdominal muscles, your obliques, and your back muscles. And at the very top of that kind of bowl of muscles, you have your diaphragm. So that entire structure, your diaphragm all the way down, is part of the pelvic floor. So how you do things as simple as breathing right can affect your pelvic floor health. If you're sitting right now here in this room and you're holding in your stomach, which I probably am, but I'm on the stage, so it's okay. But if you're holding in your stomach all the time, that's something that can be really bad for your pelvic floor. It can tighten your pelvic floor muscles. And if you don't ever release your pelvic floor muscles and let them become loose, you cannot actually strengthen them. So there are a lot of things that you're maybe doing in your life. So you could have both. There's two different extremes. There's loose pelvic floor, like if you just had a baby and your pelvic floor is loose because, you just had this baby and you start doing Kegels and you do pelvic floor work and that helps. That's loose pelvic floor. You hear a lot about that one. This is men and women, by the way. They also can have a tight, weak pelvic floor. Opposite end of the spectrum. This is you're holding those muscles tight all the time. Maybe you have pain in your abdomen, in your back, in your pelvis, and that's causing tightening. Maybe you're just holding your muscles. Maybe you're breathing improperly. So there are a lot of things that can cause that, but that can also cause sexual dysfunction. Both of those can. So those are things that a physical therapist can be fantastic. A pelvic floor physical therapist can help you diagnose and treat if you're having problems. There's also all kinds of technologies out there. My favorite one on this page is actually the middle one. This is a device called SoftWave. It's a type of low-intensity shockwave therapy. And we've been using shockwave therapy in men. This is a medical treatment, but it's super simple, super safe. Basically, it's delivering high-intensity sound waves into the tissue. And it's been used for musculoskeletal healing for decades, right? And, where you're putting these sound waves on these pressure waves, and you get activation of local stem cells, you get increased blood flow, increased blood vessel regeneration, you get reduction in inflammation, you get all these things that help the tissue heal. Well, we learned a little over a decade ago that we can use the same device to treat men who have erectile dysfunction. And it's fantastic. And it works in about 80% of good candidates. So it's pretty good. You're actually improving the health of that tissue. And we've learned relatively recently, we can also use this technology for women. We can use it for pelvic pain, even if we don't know exactly why it's happening. We can use it for just improving blood flow. We can use it, for dysfunction caused by several different things. It's super safe. It's one of these things you do in the office. It's 10, 20-minute procedure and you just leave and then that's it. It's very simple. But so that's shockwave therapy. I love that. Other thing I love that's on here is the estradiol cream at the bottom. If you are over the age of 45 or 50 as a female, I highly recommend you ask your doctor about low-dose vaginal estrogen. Everyone. It's completely safe, even if you're a breast cancer survivor. It stays generally in the pelvic floor. It doesn't get into the rest of your body. So it's very, very safe. And with this, we're going to see improvements in everything from recurring UTIs, bladder leakage, vaginal lubrication. It keeps the microbiome healthy so you don't get like lots of infections, yeast infections, UTIs, things like that. And very, very good for sexual health. You apply it like 3 days a week. It's super simple. It does require a prescription, but it's very cheap. I also like penis pumps for men. If you're not getting erections in the morning when you wake up anymore, I recommend using a penis pump because you need to get oxygen to those organs. And I also like intravaginal red light therapy for women. Less evidence, but I think it could be great. And then I also do some other kind of fancy things in my office using regenerative biologics, stem cell injections, exosomes, PRP, things like that into the genitalia. And those can also be really good. So this is kind of putting it all together with some of those regenerative therapies that we just talked about: lifestyle, hyperbarics, low-level light, hormones. Obviously you don't need all these things, but it just gives you an idea that if you're having a sexual problem, we have a lot of tools. Like, you don't have to just suffer, which I think is something that a lot of people need to hear. All right, I'm going to finish up with a story here. Oh, I'm actually going to give you this slide. So that QR code is my website. If you are interested, come scan it, sign up for my newsletter. I do a lot of education through that. Also, my Instagram for Amy B. Killen is there as well. So I'm going to wrap up with a story. About 10 years ago, when I left the ER, I had just kind of started out in this wellness world, this crazy wellness world. And I didn't know a lot of people. And I got invited to go to this dinner party at this very kind of famous biohacker's, like his home, and with their friends. And we're at the dinner party. We're just getting there. I'm totally new. I don't know anyone there. All these very important people are there. And they decide to go around the circle, and everyone is supposed to say what their superpower is. Okay? Has anyone ever been asked to do this before? This is just me. Okay. So we're going around the circle. And so someone's like, my superpower is the power of transformation. The next person is like, I have a superpower of gratitude for something. And the next one is like, I have a, motivation to live your best life. They all have these very amazing superpowers. Everyone there, like 20 of them. And it comes to me and I cannot think of anything. And so I just tell the truth. And I said, my superpower is I'm always the first person to feel rain. Like on my skin. Like, I can't predict rain. I can't make it rain. But I'm the first one in the group to be able to actually feel it rain. And I started laughing because I thought it was pretty funny. And I look around the room and they're just like stone-faced. And they're all just like, who invited this girl to this party? So I want to revise my answer. It's been 10 years. I'm going to revise my answer. So here it is. I am Amy Killen, and I am an explorer, an enabler, a promoter of one of the most important forms of human connection known to man. This connects us to our partner, but it also connects ourselves, our body, our spirit, our mind. It is a biomarker and a contributor to long-term health and longevity. I'm Amy Killen, and my superpower is sex. And by the way, that's your power as well. Thank you.